Scene assessment, situational awareness, and response activities. Putting it all together. We've done a small sampling on understanding the situation at the scene, determining that we have to build up experiences to have some type of situational awareness, and knowing the operational response of other response elements. These all take time in developing as each call that we go on builds additional layers to that experience. Let's now dive into a few cases and see if we've developed the ability to perform a scene assessment, understand our own situational awareness, and what response activities are required. Now, we are surrounded by water, and we have quite a few cases of drownings or ocean rescues. This environment can change dramatically in a matter of seconds, and it's very hostile. We need to think that we are going to need special response elements. And given the location, the proximity to our medical facility is quite far away. When we respond to motor vehicle accidents, it could be at a location, being in an area that is remote, or it could have a significant impact on the amount of casualties that we may see. In both cases, it's going to require us to consider implementing some type of mass casualty protocol and using a triage system to best manage the patients that we receive. It's also going to require us to work hand in hand with other operations and response elements. One type of situation where it's far and few and in between are disasters or hazardous response. But this could be an overturned vehicle that's carrying chemicals. It could be a response to a industrial building. It could even be somewhere on a farm that carries fertilizers, pesticides, and the like. So it'd be knowing the area, time, and event, and then determining what resources we would need. Specifically about remote locations, this brings up a public safety issue, at least for our EMS providers. In certain remote locations, we run out of comms, and being unable to communicate with dispatch or to receive or send information to the medical treatment facility makes it harder for us to adequately provide the required treatment for our patients. So I'd like you to consider these different areas as you are responding to these environments: ocean rescue, motor vehicle accidents, mass casualty incidents, dangerous, disastrous, or hazardous environments, remote locations, and or public safety concern issues. What is it about the scene that has you thinking about these? And if you haven't, this is a good time to reflect back and think about some of the cases that you've been on. Review back some of the video and pause in between and identify response elements, your patient triage, your patient assessment, your situational awareness, your scene assessment, those issues, those categories of problems that you'll have to mitigate over the course of managing a patient. Now, on every call that you go on, I'd like you to consider, what is my scene assessment? What components have I drawn from the scene and pre arrival instructions? And what have they done to increase my situational awareness? Based on my own situational awareness and experience of running calls, then what response elements and activities are important? Now remember the time, area, and type of call, as these determinants really can tell you how serious a patient is. And I'll give you one example before closing. But somebody that calls at 2 a.m. in the morning that's complaining of difficulty breathing or shortness of breath, and a house that you've been to before, potentially, maybe someone with heart problems or breathing problems, a 2 a.m. call for that case is probably going to be much more severe than a 12 noon call for that patient. Now, it's a little distracting saying that, and I'm probably using this anecdotally, but consider the area and time and the type of call, and you'll know that there's more serious during the late morning calls or early evening. Now, there are many other determinants, and I'd like you to consider to develop those and think about those as you continue in managing patients